Hey guys, what's going on? Welcome to another video on my channel Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. Visit my website at HAIRLICIOUSLY.com to purchase our microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. In today's video, I wanted to show you guys exactly how I apply topical dutasteride to treat androgen and alopecia. If you guys have not watched my recent video, I actually transitioned from 1 milligram finasteride to topical dutasteride 0.1%. I think it's one of the best hair loss medications that is out there with a good safety profile. It works better than finasteride in inhibiting DHT. And one of the main advantages that topical dutasteride has is due to its molecular weight. And theoretically, it is able to penetrate the outer skin barrier enough to bind to androgen receptors, yet not deeply enough to go systemic, or at least not to an extent that is going to be significant. You know, there obviously needs to be more in-depth randomized controlled studies, but I think this will be a good experiment to see how I respond. And I will definitely keep you guys updated over the next few months as I partake this journey on taking topical dutasteride. Now, I'm not going to be getting any blood work done, only because I know that adverse side effects are unlikely, given that number one, it's a topical and it's more localized to the scalp. I also didn't experience any side effects when I was on oral finasteride. So if I didn't experience any side effects from something that gets metabolized by the liver and goes systemic as it's taken orally, I'm likely not to experience any side effects from a topical application standpoint. But I do recommend getting blood work done for those who are wary of side effects, especially if you're on borderline levels of estrogen or testosterone. And if that's the case, I would highly recommend that you guys get blood work done for your total and free testosterone levels, things like your estradiol, total and free DHT levels, SHBG, and getting this checked prior to taking a 5-AR inhibitor, whether it's a topical application or oral, just so that you have a baseline to work off of in the event that you do actually experience adverse side effects. So this is a topical that I use from Hemia Cosmetics. It's called Dutagen. It's pharmaceutical grade. Concentration of active ingredient is 0.1% dutasteride, which is equivalent to 1 milligram of dutasteride per every 1 milliliter of solution. And like I mentioned earlier, a topical 5-AR inhibitor like finasteride or dutasteride is going to be a good alternative for those who are afraid of potential side effects from taking oral medication. And due to dutasteride's molecular weight of surpassing 500 Daltons, it's going to remain longer on the scalp, with only a minuscule fraction of it become vascularized and going systemic. And this is going to, significantly reduce already the low chances of experiencing adverse side effects, in my opinion. It has a better safety profile than topical finasteride. There are several studies that show that topical application of finasteride results in far less systemic absorption while having similar efficacy to that of oral finasteride. So, in that same sense, it's my opinion that topical dutasteride is also going to follow the same footsteps. It's going to be efficacious and even better and stronger than topical finasteride. A lot of people, believe it or not, actually skip this, or they don't know about this very crucial step before applying any type of topicals into the scalp, including things like, topical 5-AR inhibitors, topical minoxidil, topical anti-androgens, RU5841. And it's actually more geared towards people who have a lot more dandruff or oily scalps. And that's to make sure that you're starting off on a clean canvas. So what I mean by a clean canvas is that there are people who suffer from dandruff or have excessive sebum buildup on the scalp or other scalp conditions that can, theoretically prevent their topical hair loss treatments from being absorbed properly. And it's not rocket science that if you have a lot of crap that's just kind of embedded and stuck and caked onto your scalp, whatever topical that you're applying is not going to get absorbed to its full efficacy. And a great way to resolve this is to exfoliate the scalp. So I don't do this personally, but there are some people that use sea salt. They massage it over the scalp to remove, things like sebum, dead skin buildup using a manual, scalp massager or scrubber. Others use it with a good shampoo to wash before applying the topical treatment. But I would recommend doing this at least when you're applying a topical application of finasteride or dutasteride. Now, the next step is to draw up 1 milliliter of topical dutasteride into your dropper. Sometimes the dropper isn't going to be able to get all 1 milliliter of it. So to be more precise, you can actually just draw up 0.5 milligram and apply it twice. This is actually all you're gonna need, and it's gonna be more than enough for most people with anywhere from like a Norwood 3 to a Norwood 5. And in my case, I plan on applying it daily on the scalp. Dutasteride 0.1%. I do know that dutasteride has a much longer half-life compared to that of finasteride, and I know that there are people who use it just once a week. There are others who use it twice a week, but I'm going to try using it on a daily basis and see how that goes. And there really isn't a set standard of frequency for topical application of dutasteride, so you can experiment with it and see what works best for you. But I think most people can probably do it every other day, once every other day or 3 times a week, and still get good efficacy. Now, the trick here is to, instead of squeezing the dropper onto thinning areas, you just want to dab it on the scalp. I did a quick experiment, and 1 milliliter of dutasteride is equivalent to about 50 drops of the topical solution. And even without having to squeeze the dropper, you're going to be able to get the topical solution onto the scalp. Just make sure that you're applying it directly onto the surface of the scalp and not where your hair is, because if that happens, you're just going to be wasting a lot of the topical solution that's just going to be on your hair and not your scalp. If you squeeze the dropper, you're going to end up dispensing a lot more solution than necessary, and you will likely just drench one area and waste a lot of it. So you really don't want to use the you really just want to use a dabbing technique instead of just squeezing it. So in my case, I'll be applying dutasteride on the hairline and temples, as well as the areas behind it. The native areas, which are still going to be prone to miniaturization. I'm also going to be applying it on the sides of the scalp, which have been afflicted with, I don't know if you guys can tell because it's pretty short, but I have something known as retrograde alopecia, which is just thinning on the sides, which has been ongoing for a few years. So once you dab the areas, you want to rub it in using your fingers, and because this topical, for mine, is 96% ethanol based, it's going to be absorbed pretty quickly. Now, you guys probably know that I use topical minoxidil and microneedling. So my current regimen right now is to apply minoxidil twice a day, once in the morning, once at night. And then I'll be applying topical dutasteride in the evening, let it fully absorb, after about 20 to 30 minutes. I'll then apply my second session of minoxidil. If you're just using dutasteride and microneedling, I recommend that you guys still wait at least 12 to 24 hours after applying topical dutasteride for microneedling. You're probably likely to be okay to microneedle after a few hours after applying topical dutasteride. But just to be on the safe side and to avoid any potential side effects of it going systemic, I recommend that you guys wait at least 12 hours. But that's basically it, guys. This is going to be my new hair loss treatment regimen protocol. Topical dutasteride 0.1% daily, minoxidil 5% twice a day, microneedling at 1.5 millimeter once a week. And I also have to give you guys an update on Kintor's KX826 pyrolutamide. I'll be doing a separate video on this topic probably in the next day or two. But phase 2 clinical trials have finally been published after just months and months of just waiting. And I just kind of took a glance at it, and it looks pretty promising in terms of efficacy and promoting new hair growth. There are studies that show that it is even better than dutasteride, which is just incredible. But like I said, they are 2 separate different treatments. One is a 5-AR inhibitor, the other is an anti-androgen. So you can basically stack both treatments and use it to further prevent miniaturization and hair loss. Anyway, guys, let me know in the comment section below if you have any questions. Make sure to give this video a thumbs up, and I will make sure to be doing more videos. I apologize. I've just been so busy with my wife's pregnancy and just moving. And hopefully I'll be able to get back into rhythm and be able to give you guys more updates. But if you guys have any recommendations, just shoot them down in the comment section below. I'll make sure to take a look. And that's pretty much it, guys. I will talk to you guys in my next video. Until then, take care.